We're all human. And it's important to know that doctors are people too. Doctors have emotions, they have passions in life and hobbies, and they enjoy participating as active members in the communities where they practice medicine. Doctors have families, friends, and relationships, while the latest in healthcare and the most current treatments for ailments will be topics on this Doctors Are People Too radio TV show. The focus will be in learning more about the interesting aspects in a physician's life and what they do away from the doctor's office or operating room table.
Hello, South Florida and beyond. Welcome to Doctors Are People Too, and now on 95.3 FM, Facebook Live, and iHeartRadio, and everywhere else that we are. Welcome again to Doctors Are People Too. Today is a very timely episode of the show because November is Pancreatic Cancer Awareness Month. And I actually was touched by pancreatic cancer years ago living in Jupiter. My neighbor, Kenny, worked on, he had a boat mechanic business, and he worked on my boat for me. He was diagnosed with pancreatic cancer and passed away just 6 months after finding out he had the disease. And his passing touched me a lot, but also that the speed of the cancer growth with pancreatic cancer really was something that really amazed me. I had no idea that it could move that fast. And then recently with Steve Jobs, of some of the more famous people that have had the disease, computing visionary and Apple Incorporated co-founder Steve Jobs, the actor Patrick Swayze a few years ago, both battled the disease heroically and passed away. And then most recently, Ruth Bader Ginsburg, the Supreme Court judge who underwent surgery to treat pancreatic cancer and was actually able to beat it for the time being and continue with her service. Those have all been in the news, but like I said earlier, it's Pancreatic Cancer Awareness Month, and I've wanted to bring on the program for a long time now Dr. Adrian Legaspi. He's medical director for the Center for Advanced Surgical Oncology in Hialeah. He's also a surgical oncologist leading a team of 4 surgeons that treat a wide array of cancers. Dr. Legaspi, how are you doing tonight?
I'm doing very well, David, and thanks very much for the kind invitation.
And thanks for coming on Doctors Are People Too. I want to get right into it because I have a lot to ask of you to explain to the listeners about pancreatic cancer, and it is Pancreatic Cancer Awareness Month. But let's start pretty basically in the discussion. What is the pancreas and what does it do? What are its functions in the body?
Well, the pancreas is an organ that has functioned both as digestive enzymes producer as well as producer of enzymes for the breakdown and utilization of sugar, insulin. So it really serves a very important dual function to help in the digestion, to regulate how we absorb proteins and fat, and also how we regulate our blood sugar. Insulin is the main enzyme that will lower the blood sugar, but it also produces something called glucagon, which makes sure that blood sugar doesn't go to dangerously low levels. So that dual function serves a really vital function in helping us lead a healthy life.
Now, also, I wanted to ask you, I've been doing a lot of research on the pancreas this month. I wanted to ask you, one of the things I read is that the pancreas is about 6 inches long and it's shaped like a flat pear. Is that a good explanation of the actual anatomy of the pancreas?
Yes, it is. It is located behind the stomach. It's right next to the small bowel that comes out of the stomach, and above the small bowel that goes to the loops of intestine that are mobile within the abdomen. It has a head, which is the one that's very close to the small bowel that comes out of the stomach. It's called the duodenum, and that's where there's a small duct that actually force the enzymes, like digestive enzymes, to mix up with the food. And then it has what's called the body of the pancreas, where many of the digestive enzymes and the insulin and glucagon is produced. And that the part that is the most lateral, closest to the abdominal wall, is called the tail. And that is right next to the artery and vein that bring blood and take blood out of the spleen, which is another organ that is very, very important for the production of white blood cells. So it's in a very complex anatomical region in the back of the abdomen, and it's surrounded by very important vital organs.
Now, also, one of the lengthy questions that I have, and it sounds like an easy question from the get-go, but I know it's very complex, is when I was doing my research, was how pancreatic cancer develops. I know it starts with abnormal cells, but from a surgical oncologist's point of view, who treats this almost on a daily basis, how does pancreatic cancer develop?
Well, first and foremost, let me tell you that there are several types of pancreatic cancer, depending on the cells where it originates. The one that we see the most common, it's called adenocarcinoma, and that tends to also be one of the most lethal. That is a type of cancer that usually comes from the glands that produce the digestive enzymes. Another type of cancer, and this is probably the most likely type of cancer that Steve Jobs had, it's called neuroendocrine cancer, and that comes from specialized cells that produce some of the different enzymes in those specialized cells. Now, we really don't know exactly why people develop pancreatic cancer. A lot of research has been done recently to try to sort it out. And the best that we can come up with is the fact that there are changes in the genes that regulate the growth of the pancreatic cells. Now, those changes are called mutations. And it seems to be that not all the cancers have the same mutations. Now, the key challenge is to find out why some people develop those mutations and others don't. And we know that there are some precursors that can give us a hint of the probability of producing cancer. And that's something that are called pancreatic cysts. It's a little bit more complex to name, but basically they're little cysts that they form. And then as time goes by and progress, they can become cancerous. So the challenge that we have as scientists and as physicians is to try to, number one, figure out why some people develop those genetic changes. And number two is how to identify it, because the sooner that we can identify, the easier would be to treat them. Unfortunately, many times, by the time we find them, it's difficult to treat or too late. Okay? So the other challenge that we have is to really find out why those mutations occur. And hopefully in the future, we'll be able to learn how to prevent those mutations from happening. Could it be diet? It could be. Could be something that's Hereditary, yeah, it could be. Could be environmental factors, yeah, it could be. The fact is that we really don't know how those mutations occur, and therefore we're still not sure how to prevent them.
Thanks for explaining that, Dr. Legaspi. I know it's a very complex question as a surgical oncologist. You did a great job explaining it there. We're here with Dr. Adrian Legaspi. He's medical director of the Center for Advanced Surgical Oncology. That's at 7150 West 20th Avenue, Suite 615 in Hialeah. It's actually on the campus of Palmetto General Hospital. The building is right next door to the hospital. I've been there a few times. Palmetto General Hospital is located right there, 2001 West 68th Street in Hialeah. It's an exit right off the Palmetto Expressway. Dr. Legaspi's office number is 305-820-6657, or you can find more information about him or even see his education and training, medical school, etc. at dradrianlegaspi.com. That's DRADRIAN Legaspi, LEGASPI.com. Dr. Legaspi, you were explaining a little bit about the type of cancer Steve Jobs passed away, and one thing I found very interesting is I always had this notion in my mind that pancreatic cancer pretty much moves really fast, but when I was doing my research of the neuroendocrine tumor that Steve Jobs had, it said that he was first diagnosed in 2004 and actually battled the disease for 8 years until October of 2011. Is that normal for it to last that long, a fight with that type of cancer?
The answer is yes. And unfortunately, with the restrictions that we have on getting medical information, there are many gaps in the clinical history of Steve Jobs. But one could probably put it back together in such a way that it makes some reasonable sense. Neuroendocrine tumors of the pancreas are, in fact, very slow growing. And it's not uncommon to live for many years, 10, sometimes 15 years. There are medications that can slow it down. I think that probably Mr. Jobs died a little bit sooner than what he should have had, because I think he was too smart for himself. And the reason why I'm saying that is that when the tumor went to the liver of Mr. Jobs, he sought a surgeon that could do a liver transplant. And I think that was the biggest flaw on Mr. Jobs. I think that he could have lived a little bit longer if he had tried some of the other medications. Maybe he did and he didn't work. We just don't have that information. But every time you get a liver transplant, you have to go on immune suppression drugs. And that clearly accelerates the rate at which cancer spreads. So, although I don't have any of the medical facts of this treatment, what was done, what medications he received, how much the tumor burden in the liver was, I think what accelerated his death was the fact that a liver transplant had to be put on immune suppressive drugs, which we know it accelerates the rate of growth of other tumors. There are some patients that can get transplanted with cancer, but it's a very selective few, and it's usually cancer of the liver that responds better to transplant rather than anything else. But certainly when transplantation of the liver first came about, it was tried for many forms of cancer, and the clear outcome was that those patients just died quicker with uncontrollable disease. And I think for Mr. Jobs, that's what happened. Currently, for patients with neuroendocrine cancers, we recommend to try to remove the primary source in the pancreas, whether we do a partial pancreatectomy or an operation that's called Whipple, to take it out. And then if they develop metastatic disease, then treat it with drugs that will prevent that from growing, or do selective ablation of the tumor, depending on whether there's one, two, or too many. There's other techniques like infusing chemotherapy directly into the liver through the arteries that bring the blood supply. There's other techniques in which we use microbeads that are coated in radioactivity that can be applied for those type of tumors. So there's many other techniques other than liver transplantation, and I don't know if any of those were tried on Mr. Jobs, or if they were tried, they failed. But I think that he was such a smart man that he thought that if the tumor was in the liver, that a liver transplant was going to help him. And I don't know how he convinced a transplant surgeon to do the operation, but those are the facts that are known to the public in general, and that's why I surmise this is what happened to him.
Dr. Legaspi, thanks for going in such in-depth on neuroendocrine tumor and pancreatic cancer. Just hold on just 1 second there. We're going to take a quick commercial break, and we'll be right back on the other side and talk a little bit about the other cancers that Dr. Legaspi and his team at the Center for Advanced Surgical Oncology treat on Doctors Are People Too. Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIEKAKES @gmail.com, Facebook, and Instagram.
My dad is a cardiologist, and so I have two brothers, and we're all equally painful to my mom. And so to get us out of the hospital, we would go on rounds with him on Saturdays and Sundays in the hospital back in Oklahoma City. And we used to, race wheelchairs down the hallways from the time I was about 6 years old. When I was a freshman in high school, I got to watch my first heart transplant. But I think what really kind of made me want to be a doctor was around the holidays. The house always filled up with tons of gifts from thankful patients, and to impact people's lives like that in a positive manner was something that was very exciting to me. I'm very patient-oriented. I care about the patients both professionally and personally, and not only about their result, but also that I'm passionate about new technologies. I'm passionate about research, and I'm passionate about offering them the best technology available with the lowest risk and with the best outcome. What you want in a physician is someone who is personable, works as a team, embraces new technology, is clearly accomplished, but I think most importantly is somebody who you get confidence in. And the way I would have confidence is if I had a condition, I would read as much about it as I could before I showed up, probably off the internet, and then ask very directed questions. I do a lot of exercise. Running is what I use to kind of calm my brain down and kind of sort my thoughts out. So I enjoy, I just will put my shoes on and go for a run, and then I do mix in a little bit of yoga, something probably not many people know about me. I keep that on the down low, but so I do some yoga, and I go to the gym like most people.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back. Doctors Are People Too on WNN 95.3 FM, 1470 AM on the iHeartRadio app and WWNN radio app. We're here with Dr. Adrian Legaspi, Medical Director, Center for Advanced Surgical Oncology in Hialeah. It's dradrianlegaspi.com. The number's 305-820-6657. And Dr. Legaspi is on staff at Palmetto General Hospital in Hialeah. And the website there is palmettogeneral.com, and the number there is 305-823-5000. Just an easy exit right off the Palmetto Expressway in Hialeah. Dr. Legaspi, we've talked a lot about pancreatic cancer. I've got a couple more questions. You mentioned lifestyle factors with that could be symptoms, not symptoms, but that could lead to pancreatic cancer. Excuse me there. What are some of those? Is obesity one of the factors? Does smoking, drinking alcohol, using drugs recreationally, can those all lead to pancreatic cancer?
Well, I think that the most lethal combination is drinking and cigarette consumption. And not only for pancreatic cancer, but for many other forms of cancer, throat cancer, esophageal cancer, cancer of the stomach, cancer of the urinary bladder. So the combination of smoking and drinking is clearly a lethal combination. Now, being overweight is a risk factor for cancer of the stomach or cancer of the junction between the esophagus and the stomach. Many patients that are overweight will have reflux. That means that there's going to be gastric acid juice going from the stomach into the esophagus. The inner lining of the esophagus is not prepared to handle that acidic fluid, and that will lead to irritation and then turn into precancerous lesions. Now, specifically for pancreatic cancer, there's been a significant number of epidemiologic studies that try to establish a clear relationship with pancreatic cancer. Certainly, obesity has been linked. Patients with diabetes has been linked. Sometimes there have been some studies that would link coffee, but it's really not that clear, not real clear cut. The main problem with trying to pinpoint one specific factor that would lead to pancreatic cancer is that the epidemiologic studies don't take into account many factors such as how many years that person has been overweight, not how many cups of coffee have been drinking. So there's a lot of flaw. The technology and the technique where those studies are developed, so it's difficult to pinpoint for pancreatic cancer. But as a general rule of thumb, smoking and drinking should not be combined. You should really try to drink in moderation. People should not smoke at all, not even one cigarette, not a cigar, not a pipe. And clearly, being overweight is something that has to be dealt with in a very determined and very objective manner. And I know it's very difficult because many times we don't make good choices on what we eat. Our hectic lives don't allow us to exercise as much as we should. But if our population could eliminate those three dangerous behaviors, I think that we would see a significant decrease in many of the gastrointestinal cancers or cancers of the head and neck or cancer of the urinary bladder. For women in particular, overweight is the most significant risk factor for developing cancer of the endometrium, which is the lining of the uterus of the matrix. of the womb. So I think that the epidemic of obesity in this country has put us at increased risk of developing certain forms of cancer.
And we're lucky to have the insight of Dr. Adrian Legaspi here during November is Pancreatic Cancer Awareness Month. Dr. Legaspi, we've mentioned the Center for Advanced Surgical Oncology a couple times and Palmetto General Hospital. We have about 2 minutes. I want to hear from you to explain a little bit about the Center for Advanced Surgical Oncology and the program you built there, and then also at Palmetto General Hospital in Hialeah.
Well, yeah, I'm glad you asked me about this because the group consists of superb administrative staff. We put a lot of emphasis on customer service. It's integrated by 4 surgeons. I'm the senior surgical oncologist, fellowship trained. I have 3 additional surgeons. One of them is a pancreatic biliary trained surgeon. The other one is another surgical oncology trained, fellowship trained surgeon. And the third one is has a special training on robotic surgery. Now, I want to mention robotic surgery because Palmetto General Hospital just got the latest model of the surgical robot, which is an instrument that brings forward the most advanced technology for complex abdominal surgery. And the way it works is that operations that we used to do with the open technique in the past, that meant making an incision that went from the rib cage down to below the umbilicus. Now we can do it with minimally invasive technique, only using 4 or 5 small incisions, no larger than an inch. And we have magnification. We have the ability to put instruments inside the abdominal cavity, and we can remove tumors from the esophagus, from the stomach, from the pancreas, from the liver, from the colon. So it allows for less complications. Many times the surgery is done bloodless, so patients don't need transfusion. The recovery time in the hospital is shorter, and the recovery following the discharge from the hospital is shorter. The Center for Advanced Surgical Oncology has also put together a superb recovery room personnel, a superb operating room personnel, that works as a very uniform team. We have an excellent intensive care unit and step-down unit, and we have all the services that help us improve our diagnostic techniques, such as interventional radiology, and allows us to use non-surgical techniques for the management of diseases and cancers that cannot be treated with surgery. So the Center for Advanced Surgical Oncology has put together specialized teams that will look after the patient from the moment they call the office to make an appointment to the moment that they leave the hospital and go home to recover.
Dr. Legaspi, I don't think we've ever received so much information in 30 minutes on the program. You've been great. Thank you so much for sharing so much information on pancreatic cancer and the Center for Advanced Surgical Oncology on Palmetto General Hospital. I hope in the future we can have you on the program again.
Well, thanks very much for the invitation, David. It was a pleasure to talk to you and to have your listeners get informed about this very germane and significant disease.
Thank you. And that's Dr. Adrian Legaspi, Medical Director, Center for Advanced Surgical Oncology in Hialeah. It's dradrianlegaspi.com, and he's on staff at Palmetto General Hospital in Hialeah, palmettogeneral.com. Stay tuned for more on Doctors Are People Too.
I make a dinner for me and my girlfriend. We ate, we enjoyed, The dinner was very good. She was ready to go to sleep. I said, okay, I'm gonna stay on the couch a little bit to watch TV. I started to feel something in my throat, like I was choking, and all this other, I feel the pain, the sharp pain, like somebody put a knife in your back and open and do like this. That was when I called my girlfriend. I said, you have to take me to the hospital. I couldn't die. When they were doing the test, they saw something was weird. My valve was ripped. I said, God, please help me to get out of this. Dr. Valle was on call. He was who performed my surgery. I just cried like an angel. I just cried like he was there to do that for me. My girlfriend, my son, he told me when they saw him getting out from the operation room, he was sweating. He was tired to be there for 10 hours. For me, it's unbelievable. I can walk, I can exercise a little bit, and I can drink red wine, that light red wine. Of course, 1 glass or 2 glasses. I see the life different. And I want to see my granddaughter to grow and my son to get old. So I wanna live. I think that God gave me one more chance in life, and I had to take advantage of this.
Love Katie Cakes specializes in paleo, gluten-free, vegan, and regular sweets. Whether it's a cake, cookies, muffins, bites, or delicious treats, Love Katie Cakes is available for your special occasion. Katie DiPino is a certified pastry chef. Call her at 561-635-5831. It's Love Katie Cakes, LOVEKATIEKAKES @gmail.com, Facebook, and Instagram.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back on Doctors Are People Too, now on 95.3 FM and WNN 1470 AM. That's WWNN 1470 AM and 95.3 FM, and on iHeartRadio and the WWNN radio app, amp2.tv. We're everywhere. YouTube, we're everywhere. I'm so happy to have on the line tonight Dr. Sandra Lee Franco. She is a podiatrist on staff at Hialeah Hospital, but also has an interesting practice that specializes in a lot of different things as a medical spa that we're going to get into a little bit later. But I want to welcome first Dr. Franco. How are you doing tonight, Dr. Franco?
Great, thank you. Just a little bit under the weather, so excuse me if I sound a little funny over the phone.
Oh no, you sound great. I'm the weather's been great for me lately, so I'm sorry to hear that you're not feeling that well. But thanks for calling in to Doctors Are People Too. I do appreciate you taking the time.
Thank you.
What let's start with this, because I know you do a lot of work in the hospital, and you have a private practice and a medical spa that we're gonna get to in a minute that also offers foot cosmetics. I want to get into that, so I'm going to rip through a couple questions here. What are the most common types of foot ailments you see in the hospital setting there at Hialeah Hospital?
Sure, great question. Usually when a patient presents to the hospital or even the emergency room for a foot-related problem, it's going to be either for a fracture, it's going to be for a cellulitis or an infection. It's going to be for a foot ulcer, gangrene, vascular issues. Those are the most common etiologies that we find as podiatrists in the hospital setting. As a matter of fact, right now I have a patient that is in the hospital, uncontrolled diabetes, and he actually his foot became irritated with his shoe. And then it became a blister. And then shortly after, his toe became infected, became cellulitic and red. So moving forward, he actually had an amputation to the big toe. And then it became complicated, so he came back to my office to see me. And so now he has a further bone infection. So right now he's in the hospital, and he's receiving very heavy IV antibiotics to get rid of the infection of the bone. But in addition, he will need further what we call bone debridement. So we have to go back and clean out the bone, clean out any bad tissue that he's developed over the course of, the first initial problem that he had, which started as something just simple as, a blister or an irritation from the shoe. These patients, most of the time, are diabetic. So what happens with patients that are diabetic is that they start losing sensation in their feet, what's called peripheral neuropathy. And peripheral neuropathy can stem from different aspects. It can stem for vitamin deficiencies, medications, back problems, patients with HIV, etc. In this case, it was a patient with peripheral neuropathy, and something like that can become something huge. A patient that's diabetic and steps on something, he might not even feel it. I've seen patients that have actually stepped on nails, and they didn't even know until they started smelling something odd coming from their foot, and sure enough, they had already an infection happening. So peripheral neuropathy is the number one thing that podiatrists see. We see that a lot. We see a lot of diabetics, patients that have an immunocompromised system, like diabetics, are more prone to infections, from something as simple as a fungal infection all the way as something as serious as a bone infection. So these are our patients that we try to see more often in the office setting for prevention. So, but going back to your original question as to what do we see in the office, in the hospital setting, that's what we usually see are the fractures, infections, gangrene, ulcers. So not fun seeing that in the hospital, especially when you have to give someone bad news, that they might lose a limb or a toe. That's not always a fun thing good news to break to a patient.
And that sounds like a very complex case. It sounds like also he's lucky to be in your hands there as a podiatrist, because you're very knowledgeable on the diseases there and the subjects. Now, also, we talked a little bit about diabetes and the foot and the diabetic foot and gangrene briefly there, but I know another things that you treat that I had to look up after we talked, because I wasn't that knowledgeable on it, was pressure sores. What is a pressure sore, and is that something that could actually hospitalize someone?
Absolutely. Those patients that are unfortunately bedbound, patients that have cerebral vascular accidents, that unfortunately can't move, or the elders that are bedbound, or patients that have had traumatic accidents, those patients, the pressure of being in a one position, what happens is that area, that tissue, it starts losing oxygen. When there's no oxygen, there's no blood flow, and that area becomes a pressure ulcer. The simple aspect of the friction of the bed from the sheets, or the movement of the limbs, if they have any, can cause irritation on the skin and can break down the skin. Those patients that are usually bedbound will have heel ulcers and sacral ulcers. As a podiatrist in the state of Florida, we can only treat from a little bone just below the knee all the way to the tip of the toes, not including the knee. So that's usually what entails a pressure ulcer. Mostly, when you see a sacral ulcer is an ulcer in the back, in the lower back. You will almost always see also a pressure ulcer of the heels.
I see. Now, what happens if something like the diabetic foot, a pressure sore, a foot ulcer, or like gangrene is left untreated? If someone wasn't to go to the hospital, what could be the worst case scenario? Why is it so important to see a physician, get to the emergency room, or even call your local podiatrist?
Right. So those patients can lose a limb. Those are the patients that, unfortunately, we have to go in there, clean out the bone, resect the bone. Usually when you have one amputation to a digit, the likelihood of you having further amputations, as well as the below the knee or even above the knee amputations, are greater the likelihood of you having those above the knee or below the knee, you're at greater risk. And obviously the morbidity of those patients increases. So we want to prevent that. We want to prevent that by those patients that are bed-bound, that they want to offload the heels. They want to do constant rotation of the patient in the bed. There's special beds for those patients. They're called air mattresses. And so those are very helpful for those patients to prevent breakdown of skin. Once the skin breaks down and the patient is bed-bound, those are the patients that are very hard to heal. They have other issues, vascular issues, like I said, maybe contracted limbs. So those are patients that are very, very hard to treat, unfortunately. And so, there are definitely a lot of therapeutic strategies. There's things called a vac, which is basically a vacuum, and you apply it to an ulcer, and what it does, it kind of sucks out any drainage or any infection that they might have. There's other options like grafting. That's a huge industry. And then they have stem cells, and they have the platelet-rich plasma. Those are a little bit more of the higher-end technological aspects of podiatry, and they help a lot. They help regenerate tissue, and that's what we need. When there's a breakdown of tissue, you need to regenerate. You need to help that person heal so that person is not going to end up as a below-the-knee amputation or an above-the-knee amputation.
And we're here with Dr. Sandra Lee Franco, podiatrist at Hialeah Hospital. It's hialeahhosp.com. That's HIALEAHHOSP.com. The number of Hialeah Hospital is 305-693-6100. It's 651 East 25th Street in Hialeah. Dr. Franco, I got a couple more questions before we take a quick break, but does wearing improper footwear, can that lead to foot injuries and ailments? I know we've seen it with high heels. I think we all know about that, but are there other types of sandals, shoes that can cause foot injuries and ailments?
Absolutely. For diabetics, because that's always a hot topic, for diabetics, they should, insurance companies actually cover a pair of diabetic shoes once per year. And the importance of those shoes are because they don't have a seam. So the prevention of the seam will decrease any blistering or any rubbing of the shoe. In regards to those us vain girls that love to wear high heels, there are issues, ankle sprains that could happen from high heels. You can have the tendo Achilles pain. You can have pain in the arch of your foot. Sports-related injuries are a big topic. You always want to make sure that you're strapping your ankles, especially if you're a basketball player or you're a soccer player. Any of those high-impact sports, you definitely want to wear the appropriate shoe gear. Anything in excess is not good. So my recommendation is moderation. Moderation with those heels. Moderation, obviously it's hard to say moderation for those sports fanatics or those athletes, that's their life, but definitely taking the proper precautions and using ankle strapping. They always have a trainer on site, and those athletes usually get strapped before they go out and play their sports.
Now, a question I also had is, should I be going to a podiatrist every 6 months, like when I get my teeth cleaned or maybe when I have a checkup with my primary care? Should I have a podiatrist in my Rolodex there and be seeing one on a regular basis, once, twice, 3 times a year?
Absolutely. I recommend that at least twice a year, every 6 months for someone to come and visit the podiatrist. And this is all for prevention. Something as simple as what you might think is just a little bump on your skin could actually end up being a skin cancer. Or, a little discoloration of your toenail could actually be a toenail fungus. So prevention is a key. You want to make sure that you treat something before it becomes worse. And I think that's where people lack to understand that as podiatrists we do a lot. We do ankle fractures. We can screen and diagnose vascular compromises, or if there's decreased pulses in your foot, we might recommend you to see a vascular surgeon. Cancers. So you name it, anything below the knee, please don't hesitate and see a podiatrist. Very important for someone to get seen, as you said, as a routine base, at least every 6 months. Very important.
And I didn't know that podiatrists treat just below the knee all the way down the foot. So thanks for sharing that with us. I'm not sure if all listeners know that. And the coverage of diabetic shoes, people can re-listen to this program on amp2.tv's YouTube channel if you missed that. I know you spent a lot of time in the hospital setting. Do you also have an office on the campus there right near Hialeah Hospital? Is it on the campus actually?
It is on campus. I have two offices, one there at the Hialeah Hospital. I'm located on the 5th floor at the medical office building. So it's just a step away from the hospital, so it's very convenient for patients. And I have a second location that is in Miramar, and my office is centrally located. There are two hospitals that are less than 3 miles away from each other, so we're very centrally located. Which is also important, and it's very convenient to patients. So if they needed to be admitted for whatever reason, they're just down the street per se.
And Dr. Franco's podiatry practice is located at 777 East 25th Street, Suite 502 in Hialeah, right there on the campus of Hialeah Hospital, and then also in Miramar at 2407 Main Street in Miramar. The number there in Miramar is 954-436 7400. That's 7400. Dr. Franco, hold just a second. We're going to take a quick break, and on the other side, talk to you a little bit more about something different. You're a pioneer in terms of a medical spa I want to get into on Doctors Are People Too.
Perfect.
Hi, my name is Dr. Rahul Agarwal. I'm an interventional cardiologist in Jupiter, Florida. I did my medical school at the University of Florida and my internship and residency at the same program. I did my chief residency also at Shands, and then did my cardiology and interventional cardiology at Wake Forest University in Winston-Salem, North Carolina. I specialize in general cardiology, interventional cardiology, and nuclear cardiology. Even though I'm an interventional cardiologist, the majority of my practice involves general cardiology. General cardiology is a pretty broad spectrum in that it involves rhythm problems such as atrial fibrillation, heart disease such as coronary artery disease, congenital heart disease, high blood pressure, and cholesterol problems. I do procedures such as cardioversions, which involve trying to convert the patient back to a normal rhythm if they have an arrhythmia. I also deal with plumbing problems such as the coronary arteries, which if they're blocked, I can do angioplasty and stents, which involves balloons that open up the arteries. And these stents act as scaffolds that keep these arteries open. I really do believe in preventive medicine, and one of the areas that I really focus on is diet. One can really get caught up on the pills aspect and the exercise. And diet we talk about a lot, but unless one really has some guidance as to where to go with diet, it can be quite difficult. So I do give my patients homework in terms of books or movies that they can rent or obtain so that they can get educated. Our cardiology office is located in the Abacoa area of Jupiter, Florida, conveniently located between two of the local hospitals. We provide echocardiography, stress testing, ultra monitoring, and general cardiology office visits. We really pride our practice in its staff, who are very courteous and professional. We believe that under our care, you'll feel the same way too.
Tenet Florida Physician Services is a multi-specialty physician group providing care to the communities of Palm Beach, Broward, and Miami-Dade since 2007. The TFPS team is committed to delivering quality care. Our mission is to improve the quality of life of everyone who walks through our doors. Today, we are proud to be one of the largest and most respected physician networks in the area. To learn more about Tenet Florida Physician Services, visit tfpsdocs.com. That's tfpsdocs.com. Or to find a doctor, call 1-866-654-2362.
You are listening to Doctors Are People Too with David DiPino, who shows us the human side of medical doctors in the community. If you have a question for our guest, call into the show at 888-565-1470. Now, let's get back to the fun side of doctors and show that they are people too.
And we're back with Dr. Sandra Lee Franco, a podiatrist on staff at Hialeah Hospital and with private practices right there on the campus of Hialeah Hospital and also in Miramar. Dr. Franco, I'm not really into high heels, but I recently discovered pedicures, and it's changed my life. So I want to ask you a little bit about your medical spa and foot cosmetics. Can you tell us a little bit more about that? And I'm not sure if we lost Dr. Franco there.
I'm a pioneer in the industry. So what is a podiatry med spa? It's still very new, so people are now starting to catch on to it. So what a podiatry medical spa is that when you come in and get a manicure or pedicure, you're screened by myself. So there's always a physician on site. And so all the procedures, as simple as we might think is a manicure and pedicure, they're supervised by a physician. And that's very important. Sometimes, when we go to regular nail salons, it's not. So we don't know truly what's going on. It starts out with something simple, and obviously you probably can't relate. But the first thing that happens when you go in to get your manicure and pedicure, they tell you, go pick out your color. You go pick out your color. You don't know how many times that nail polish brush has encountered all these toenails throughout the lifespan. A nail polish can probably polish maybe 100 nails. From those 100 nails, say 60% of those patients have toenail fungus. That nail brush that you are using for your nail polish has now encountered toenail fungus. And there are no clinical studies or anything that I can attest by 100%, but it is to my belief that if you are in close proximity with fungus from someone else and you're using the same brush on yourself, you are going to be highly susceptible of obtaining toenail fungus. And so everything here at this medical facility, this medical spa, is disposable. So the girls use disposable brushes for their manicures and pedicures. Our soaking baths, we use disposable liners. The quality of sterilization is hospital grade, so we don't use, a standard small little sterilizer. We don't believe in that. Everyone gets a new set of instruments, a new clean set of instruments, and that's very important to us. We pride ourselves in our sterilization and our cleanliness of our facility. So anyone can come in for a manicure and pedicure. This is not for those that, have diabetes or someone that has poor circulation. Our medical office, the medical spa aspect, is open to the general public. We only go by appointment because it is a medical office. And so with that said, we do follow all of HIPAA and OSHA guidelines, which is very important. We use private rooms. So, for those that might be a bit embarrassed about, what their feet look like, maybe they have, hammer toes, or they might have a bunion, or maybe, thick toenails, those patients or guests might feel a little bit uncomfortable going to a public area where you're sitting and everyone is looking at you. So that is the concept here at this office, in the Miramar office. We also do Botox in the feet. We do injectables, such as Juvederm in the feet. And the Botox we use for hyperhidrosis in very, very mild cases of a bunion where we can paralyze the muscle a little bit to prevent, that deviation of the toe. In regards to the fillers of the feet, we actually use that, going back to your question of the high heels, if we should wear comfortable shoes. I have quite a few patients that, their job requires them to wear heels. And so what I do is I inject in the ball of the foot a little bit of the product so it gives them a little cushion so that when they're walking, they're not putting all that pressure on their metatarsals. We do sclerotherapy, which are spider veins. We do toenail fungal laser treatments. We do a vast amount of cosmetics. I would suggest for our listeners to log on to our website to see all the great services that we offer here. I could go on and on about all the services. We do facials, we do waxing, so it's a full service. And we also, so what I do is I screen these guests when they come in. So you come in to get your manicure and pedicure, and what I do is I screen you. And many times, I have to say, and maybe my percentage is off, but I want to say about 70% of the times that I screen a guest, they will have toenail fungus. And they believe that they were told erroneously by maybe a nail tech or a nail salon, that discoloration of the toenail was caused because of the nail polish. And in part that is true, but that is toenail fungus. It's a very superficial toenail fungus. It will look almost like a chalky appearance on the surface of your toenail, and if you buff it out, it will come out. But if you don't treat it adequately, it's going to start eating away at your whole toenail, and now your treatment is going to be extensive because the toenail grows about 1 millimeter a month. So the big toenail, that's about 12. That's about a year for the toenail to grow out, and not to mention that the treatment for toenail fungus is very expensive. And so we are all about prevention and about education and letting our guests know that there is a place, there's a safe haven for them to go and get their manicures and a pedicure. You wouldn't even believe all the things that I've seen throughout my times of practicing. Patients that were diabetic, that had poor circulation, and just from a little nick from having a pedicure ended up in an amputation. So that's what we're trying to prevent here. We're trying to prevent further limb loss, and I hope that me feeling as a pioneer in this industry of a podiatry med spa might encourage more of my colleagues to go ahead and start something like this, because it's a need in our community. It's something that is very important, and we need to educate. We need to let people know that it's something serious. It's very serious. Something as simple as what you think is a pedicure can lead into something very, very complicated.
And the website is francoandcompany.com. It's FrancoAndCompany.com. That's francoandcompany.com. And it's a podiatrist-run medical spa. Just genius. Dr. Franco, I want to thank you so much tonight for sharing so many different aspects of podiatry with us on Doctors Are People Too. I look forward to having you on in the near future. Thank you.
Absolutely. Likewise. Thank you so much. Happy holidays.
You too. And that was Dr. Franco, a podiatrist at Hialeah Hospital and with private practices at Miramar and Hialeah, and francoandcompany.com medical spa there on Doctors Are People Too.
Thank you for listening and watching Doctors Are People Too with David DiPino. Join us next week for more in-depth views on what doctors are all about and how they spend their free time. All shows can be seen on amp2.tv. And if you have questions you want answered on the air, call 866-224-5422 and leave a message that can be read on the air. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those